Fallopian tube cancer is a rare but serious malignancy that affects the fallopian tubes, a part of the female reproductive system. In this comprehensive guide, we will explore fallopian tube cancer, its diagnosis, treatment options, prognosis, promising therapeutics, and more. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is fallopian tube cancer? Fallopian tube cancer is an uncommon cancer that originates in the fallopian tubes, which are responsible for transporting eggs from the ovaries to the uterus. Like other gynecological cancers, fallopian tube cancer can be challenging to diagnose in its early stages because symptoms often mimic other, more common conditions. Types of fallopian tube cancer. The most common type of fallopian tube cancer is called serous carcinoma, which often resembles serous ovarian cancer. Other, less common types include endometrioid carcinoma, clear cell carcinoma, and mucinous carcinoma. Diagnosis. Diagnosing fallopian tube cancer typically involves several steps, including medical history. A thorough review of the patient's medical history, including any gynecological issues or symptoms, is essential. Physical examination. A pelvic exam may reveal abnormalities such as enlarged ovaries or masses. Imaging studies, transvaginal ultrasound, Connecticut scans, or MRI scans may be used to visualize the pelvic area and identify potential tumors or masses. Biopsy. A tissue sample, biopsy, is often necessary to confirm the diagnosis and determine the cancer's type and stage. This can be done through surgery or minimally invasive techniques. CA-125 blood test. Elevated levels of the CA-125 protein may be indicative of fallopian tube cancer, although this test is not specific to the disease. Standard of care treatments. The treatment approach for fallopian tube cancer typically involves a combination of surgery, chemotherapy, and, in some cases, radiation therapy. Surgery. The primary treatment for fallopian tube cancer is typically surgical resection, which involves removing the affected fallopian tube and often the ovaries and uterus. The extent of surgery depends on the stage and spread of the cancer. Lymph nodes in the pelvis and abdomen may also be removed for staging. Chemotherapy. Following surgery, chemotherapy is usually recommended to eliminate any remaining cancer cells and reduce the risk of recurrence. The specific chemotherapy regimen may vary based on the cancer's type and stage. Radiation therapy. Radiation therapy may be used in some cases, especially if cancer has spread or if there is a risk of recurrence. It involves targeted radiation to the pelvis and may be used in combination with chemotherapy. Prognosis. The prognosis for fallopian tube cancer depends on several factors, including the stage at diagnosis, the cancer's type, and how well it responds to treatment. Stage 1. Fallopian tube cancer diagnosed at an early stage, when it is still confined to the fallopian tubes, generally has a better prognosis. Surgical resection followed by chemotherapy can be curative. In early stage, Stage 1, serous carcinoma, the 5-year survival rate may range from approximately 60% to 80% or higher, depending on factors such as the extent of surgical resection and response to adjuvant chemotherapy. Stage 4, advanced fallopian tube cancer that has spread to distant organs or structures typically has a less favorable prognosis. Treatment aims to control the disease and manage symptoms, but a complete cure may be more challenging to achieve. The 5-year survival rate for stage 4 fallopian tube cancer can be lower, typically ranging from 10% to 30% or less. The main form of fallopian tube cancer is known as serous carcinoma. Other forms of fallopian tube cancer are endometrioid carcinoma, clear cell carcinoma, and mucinous carcinoma. Endometrioid carcinoma and clear cell carcinoma are roughly as serious as serous carcinoma, while mucinous carcinoma is generally more serious than serous. Early diagnosis and prompt treatment are critical for improving the prognosis of fallopian tube cancer, promising therapeutics and ongoing research. As fallopian tube cancer is relatively rare, research into new therapeutic approaches is ongoing. Promising developments include PARP inhibitors. Poly-ADP ribose polymerase (PRP) inhibitors have shown effectiveness in treating certain types of ovarian and fallopian tube cancers, particularly those with BRCA gene mutations. Olaparib and niraparib are examples of PRP inhibitors used in clinical practice. Immunotherapy. Some clinical trials are exploring the potential of immunotherapy in treating fallopian tube cancer. Checkpoint inhibitors, such as pembrolizumab and nivolumab, are being investigated. Novel chemotherapy combinations. Researchers are studying new chemotherapy combinations to improve treatment outcomes and reduce side effects. A website to research clinical trials for fallopian tube cancer is onclive.com. The book, Cancer Self-Defense 101. Quick Tips to Help You Survive has many examples of challenges of fallopian tube cancer. Fallopian tube cancer presents unique challenges. Late diagnosis. Most cases are diagnosed at an advanced stage because early-stage cancer typically produces no noticeable symptoms. Similarity to ovarian cancer, fallopian tube cancer closely resembles ovarian cancer in terms of symptoms, risk factors, and appearance under a microscope. Aggressive nature. Fallopian tube cancer can be aggressive, and by the time it is diagnosed, it may have already spread to other areas of the pelvis or abdomen. Limited treatment options. Treatment options are limited, and standard therapy often involves aggressive surgery and chemotherapy. Emotional impact. Coping with a rare gynecological cancer can take an emotional toll on patients and their families. Risk factors. While the exact cause of fallopian tube cancer is unclear, certain risk factors may increase the likelihood of developing the disease. Age. Fallopian tube cancer is more common in women over 50, but it can occur at any age. BRCA gene mutations. Inherited mutations in the BRCA1 and BRCA2 genes are associated with an increased risk of fallopian tube cancer. Family history. A family history of breast or ovarian cancer may elevate the risk. Infertility or nulliparity. Women who have never given birth or who have struggled with infertility may have a slightly higher risk. Resources and support. Facing a diagnosis of fallopian tube cancer can be overwhelming, but there are resources and organizations that can provide information, support, and guidance. National Ovarian Cancer Coalition. Although fallopian tube cancer is distinct from ovarian cancer, these organizations often offer resources and support for gynecological cancers. Cancer support communities. Local cancer support groups and online communities can connect patients and caregivers with others facing similar challenges. For more information, please see the book Cancer Self-Defense 101. Quick Tips to Help You Survive.